Hello, this is Dr. Leslie Haller. Last week I gave a talk to the Riviera Study Club, and several people were not able to attend, and they asked if I had recorded the talk, which I had not, but I thought I could at least put a soundtrack. Hello, this is Dr. Leslie Haller. Last week I gave a talk to the Riviera Study Club, and several people were not able to attend, and they asked if I had recorded the talk, which I had not, but I thought I could at least put a soundtrack behind the slide deck and send that out to you. So this is an approximation of what I talked about on September 23rd at the Globe. A bit about me. I graduated from Harvard and practiced general dentistry in Boston for 20 years before my dear husband decided that he would like to retire to Florida, where I did not have a dental license. What do you do when you don't have a dental license? You go back to school. So I started learning about lasers and ultimately became board certified in lasers. And one of the really cool things you can do with lasers is release tongue ties. So when I eventually did obtain a Florida dental license and was working as an associate, I started doing tongue ties and treating airway patients. Eventually opened up my own place on Alhambra Circle here in Coral Gables, and I built quite a substantial practice in tongue ties, and I noticed that these little kids, these little babies were snoring, and I realized that tongue ties were somehow related to breathing. I also noticed that many of my adult tongue tie patients reported that not only was their range of motion better and their speech easier, but that they could breathe easier and many times stopped snoring. So I began studying in-depth sleep dentistry and started out with the SomnoMed and the mandibular advancement devices. But during my attempt at taking classes to become board certified in sleep dentistry, they had a talk by an ENT who said that tongue ties didn't contribute to sleep at all. So I dropped that line of education and moved on to in other directions. But sleep dentistry has become so amazing, along with the tongue ties, that I have dropped general dentistry altogether and do nothing but tongue ties and airway. This stuff is so life-changing. I just don't want to do anything else. There is a lot to know. I'm going to talk a bit about what's happening, the sleep epidemic, and how the research evolved, how sleep and breathing have been treated and how that has evolved, how I treat it using epigenetic remodeling, and what you need to know to refer. You've probably already heard about epigenetics, and that is what's happening. We used to think we were basically victims of our DNA. Whatever our DNA said, we were stuck with, and that was that. But we now realize that certain environmental influences can change the way our existing DNA expresses itself. And because of that, our Western diet and lifestyle has led to a decrease in the size of the skull, especially maxilla and the mandible. Things like a reduction in breastfeeding, eating softer foods, processed foods, all of these things have led to a nasal area which is smaller, which causes mouth breathing and sleep issues. Even as recently as 2018, this was still considered a fairly novel idea. Here is James Nestor, a popular author, talking about all of the bad effects of sleep apnea.
Matter of fact, poor breathing habits were attributed to a number of chronic problems: hypertension, depression, chronic sinusitis, acid reflux. All of these things were either exacerbated or sometimes caused by poor breathing. So I realize this all sounds pretty wacko, but this was all clarified by dozens and dozens of different studies over decades and decades. So I thought I'd explore it a little more, and I heard that the only way to really understand what has happened to us, why we breathe so poorly now, is to understand our evolution. So I went to the University of Pennsylvania, to the Anthropology and Archaeology Museum, where they have one of the largest collections of pre-industrial skulls in the world. And one thing these researchers told me, they said, if you're going to understand breathing, you have to understand the mechanisms of it. And they said, of the 5,400 different mammals on the planet, why are humans the only ones with crooked teeth? If you look at chimpanzees, perfect teeth. This gentleman, the Bergerac macaque, perfect teeth. Marine mammals, guess what? They all have perfect teeth. Even my dog, I pinned her down, took a picture of her teeth, and they were perfect. Meanwhile, this is what we have. This is pretty common for young people to have teeth like this. And if we don't do anything about it, they can end up like this. So 80 to 90% of us have crooked teeth. Why? So the next question they asked me, they said, of the 5,400 different mammals, why are humans the only ones who have sleep apnea? Why are we the only ones that snore? Some bulldogs snore, but beyond that, humans are the only ones. 50% of us snore, and a quarter of us suffer from sleep apnea. So why? Why would this happen? I've always thought that crooked teeth, I thought that this was a genetic problem, but then I thought about it a little more, and my parents had great teeth, and I had awful teeth. Then I thought, sleep apnea, that's always a problem associated with obesity, but it's actually not. Tens of millions of skinny and normal weight people also have sleep apnea. So the answers, they told me, are in the human skulls. And by looking at...
Here's another clip from that same talk by James Nestor. His animations are terrific, so have a look.
Compared a Neanderthal with a human, Neanderthal is on the right, of course, you can see this forward facial growth, this prognathic facial growth here. This guy could breathe so easily, whereas humans were getting flatter and flatter. In the last 10,000 years, here's where things got really crazy. This is how we looked like about 8,000 years ago. This is about 2,000 years ago. And coming up here is how we looked about 300 to 400 years ago. So you see how much skinnier and how much longer our faces have become. But by far, the biggest change happened in the last 400 years. That's when we went from having this forward facial growth to having this retruded and recessed facial growth. So that's about 300 years ago, that's about 200 years ago, and now about 90% of us have a facial growth that is recessed and flat, much like mine. So if you...
I promise this is the last clip from James Nestor. After all, I'm supposed to be the one speaking, but his animations are just so wonderful. I have to share them with you. The point of all of this is that it is the maxilla. The maxilla is underdeveloped. It's not large enough to hold all the teeth, so they come in crowded. The mandible gets trapped behind the two small maxilla, causing TMJ issues. And the narrow maxilla leads to mouth breathing and sinus issues. So one more clip from James Nestor.
At it. This woman represents the sort of facial growth that we had about 500 years ago. As the centuries pass, she starts representing where we are now. So what happens when your face grows backwards and your mouth grows smaller? Seen right now is what has happened to the airways in humans. This is why we have sleep apnea. This is why we have crooked teeth. And this is why we can't breathe right. And this is also why, one of the main reasons why we have so many chronic problems. I just looked up sleep apnea on a good friend PubMed here, and there's like 7,000 different articles showing the deleterious effects of sleep apnea. So are you guys depressed?
sorry.
At it. This woman represents the sort of facial growth that we had about 500 years ago. As the centuries pass, she starts representing where we are now. So
the problem is we have a bottleneck, a constriction in the pipeline for the air to go from the nose down behind the tongue and down into the lungs where we need it. And of course, humans being what they are, we have come up with many solutions to this problem. The first is the CPAP machine, which is the gold standard because it was the first. And what it does is it pushes positive pressure air through the nose and mouth and pushes it past the bottleneck to get down into the lungs. And it works. It's not necessarily comfortable to wear, but it does work. Then we've come up with all sorts of other inventions. The dentists came up with the mandibular advancement device, which is just mechanically props your lower jaw forward to keep the tongue out of the airway. That doesn't work as well as the CPAP side by side, but because people are more willing to wear it than the CPAP machine, it tends to have a much higher compliance rate, and therefore sometimes comes out looking better on the treatment effectiveness studies. Other things have been this little gadget here. Do you remember TENS machines? This is a little TENS machine that you put on the back of your tongue, and it stimulates the muscle and strengthens the muscles of the back of your tongue. It's actually in clinical trials over at Jackson Memorial right now. And this is one of my all-time favorites. You just take this little plastic doodad and you stick your tongue into it and you sleep with that holding your tongue forward all night. And then this other thing is called, I don't know if you've heard of Inspire. It's like a little pacemaker. It's implanted in your chest like a pacemaker, but instead of being connected to your heart, it has a connection to the back of your tongue, and when it detects that you have stopped breathing, it zaps your tongue and gets it out of the airway. And sometimes advancing the mandible isn't really going to help at all. The problem with all of these devices is that you have to wear them for the rest of your life. What if we could just get rid of the bottleneck? What if we could just grow the airway larger so that you don't need any devices at all? And that's where epigenetics comes in again. We use the same ability to alter the way our DNA expresses by changing the signaling that we get from the environment. By wearing a specially designed appliance in the evening and while you sleep, it sends signals to your stem cells in your epigenetic growth centers to literally cause the maxilla to grow more bone. It allows the mandible to come forward, which gives the tongue more room in a larger mouth. It's painless. It works in adults as well as children, and it's permanent bone remodeling. It was the invention of the cone beam CAT scan in the early 2000s that enabled us to be able to see growth in 3 dimensions. This led to clinical experimentation with growing palates in adults using environmental signaling to change gene expression. These 3 gentlemen are early thought leaders in this epigenetic remodeling applied to dentistry. The man in the middle is Dr. David Singh, and he is the academician of the group, and he wrote a textbook back in 2009 called Epigenetic Orthodontics. I highly recommend it. The other 2 are academically oriented clinicians, such as myself and you as well. And Dr. Liao, who I've trained with personally, wrote the book 6-Foot Tiger in a 3-Foot Cage, which I particularly like because he's referring to the tongue feeling like a 6-foot tiger in a 3-foot mouth. The mouth should be bigger for the tiger, not the tiger smaller for the mouth. And Dr. Belfour, who I've also trained with, who worked with the Mayo Clinic, who developed some very amazing software that shows how to analyze this cone beam technology. And in this picture, you can see where they have overlaid the before and after. The green is the growth that changed after treatment with an epigenetic appliance. Pretty amazing stuff. And as brilliant thought leaders are want to do, while they agree on the basic research, they have different approaches to how they think things should move forward. Dr. Singh became part of a company called Vivos and developed and patented and got FDA approval for his appliance called the DNA. Dr. Liao left Vivos, developed his own appliance, patented it, and got FDA approval for the STA appliance. And Dr. Belfour developed his own HomeoBlock appliance, also patented and FDA approved. All of this research and clinical work was limited to a pretty small number of people. It has grown now that these thought leaders have been training other clinicians, such as myself, but even so, it's been slow to reach the medical community and the dental community. One big change has been the publication of James Nestor's book, Breathe, which became a bestseller in 2020. If you haven't read it, you need to know about it because people are reading it and they're going to come to you and ask you what this is about, and hopefully you will be able to give them an intelligent response. James Nestor has been interested in breathing for much of his life. He was treated by Dr. Belfour and completely blown away by how the epigenetic remodeling of his airway improved his breathing. So I highly recommend reading his book. And this is it. These are some examples of epigenetic remodeling appliances. On the left is a DNA appliance with a sagittal split, and on the right is a Dr. Liao STA appliance with a 3-way split. The design varies based on the case, of course, but they're basically a gelb-like appliance that is worn in the late afternoon and all night long that gently stimulates stem cells to grow. It is not a rapid palatal expander. Don't let those screws fool you. They are not there to apply pressure on the teeth to force the midline suture to split. It's nothing to do with the midline suture. The screws are simply to be able to snug up the appliance after growth has happened. It's all about the bone. I know it's really hard for us. We're so tooth-oriented, but it has nothing to do with putting pressure on teeth. It has to do with stimulating the bone, and it's not painful. Examples of this are all over the internet. The woman on the top here, in fact, both of these women are early Dr. Singh examples. And one thing you can see is that the appliance, because it's using your own DNA, tends to even out asymmetries, tends to even out the eyes, tends to widen and raise the cheekbones. It tends to make you a more attractive person. In fact, Dr. Belfour doesn't even promote his appliance as a sleep enhancer. He strictly refers to it as an anti-aging device. This is another Dr. Singh example. In fact, I think it's from the photo on the cover of his first textbook. But you can see how the entire arch shape has changed. You can't do that with orthodontics. You can't just slide teeth around to make that arch shape wider and more U-shaped. And when you look at the effect of that, you can see this woman's chin has come forward as her maxilla has changed. Here in the example on the left, you can see how widening and enlarging this woman's maxilla allowed her mandible to come forward. On the right, you can see how enlarging the maxilla allowed her mandible to stay right where it was, but look at the change in her profile. And you can imagine how much improvement she experienced in her breathing. This video was made by a colleague of mine, Dr. Tara Griffin. She is a big advocate of the Vivos DNA appliance, and this is basically the typical Vivos DNA video for explaining how this works. And it's something I think you should know that people are watching out there on the internet, and I think she does a good job of explaining it all. And she, just like me, was her own first patient. I used to have a CPAP machine. I treated myself with a DNA appliance, and now I don't have a CPAP machine anymore. My facial changes aren't as dramatic as hers, but have a listen.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos appliance. As soon as I started treatment with the Vivos appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos appliance is worn in the early evening or while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs. And we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos Appliance, if this would be good for you, then I recommend you coming into a Vivos Center to be evaluated to determine if this is something that could help you.
It's patients like this that make me want to do nothing but airway and tongue ties. It is so life-changing. I just can't say enough about how it's affected me watching people feel so much better. This was one of my early Vivos cases before I trained with Dr. Liao or Dr. Belfour. This young man was miserable. He couldn't sleep, he couldn't study, he couldn't exercise. He had tried various diets. He was just desperate. And because he's only 20, 21, something like that, his treatment went very quickly. Within about a year and 12 months, he went from a profile on the left, which is completely flat, to his lower jaw coming forward and being able to breathe through his nose. And listen to what he had to say.
Months and you're getting ready to graduate. Your sleep study says you no longer have sleep apnea. Can you tell us a little bit about your story?
The first time I came here, I felt like a zombie. I felt very bad. I could not breathe through my nose. I was starting to lose that. I mean, that sounds very weird, but it was getting very blocked. And the interesting thing is the first 3 days, I think I got the Vivos treatment on a Wednesday, and on the next Friday, I could breathe very well through my nose. Another amazing thing about this treatment is that I had sensitive teeth beforehand, and I would say that almost immediately after the second night of wearing this device, that teeth sensitivity was gone. I also had a lot of back pain and neck pain and postural problems. I think that has greatly improved, and that's a great relief. My sleep, I think it has definitely improved, but I think it's a bit difficult for me to say since I'm not awake while I'm sleeping. But they did the sleep studies, and my sleep apnea has definitely, I no longer have sleep apnea.
Congratulations. Thank you. So you're happy.
Correct. I am very happy.
Very good. Thank you so much.
Here is another one of my early Vivos cases. This young woman was beautiful when she came in, but look how lovely her profile got after about a year and a half worth of treatment. And listen to what she has to say.
So I'm a patient of Dr. Haler's. This is my 6-month follow-up, and I have to admit I was very skeptical about the Vivos treatment starting out. I actually didn't even know I had a problem. My boyfriend told me I was stopping breathing in the middle of the night several times, which is really quite scary, all the health problems, and obviously I don't want to stop breathing. In any event, I've been doing the treatment now, and I sleep better. My boyfriend tells me I don't stop breathing anymore, and I notice a difference. I breathe better. I feel like there's more room in my mouth for my tongue, which sounds a little weird, but is actually true. And I just think overall quality of life is better, because if you get better rest, you can be better at everything. So I'm not quite there yet, still working on it, but I have to admit the results so far have been pretty good.
Thank you very much.
This young man uses his CPAP machine every night because without it, he can't sleep. Does he love it? No. And he's hoping that by enlarging his maxilla, he will be able to get off of it. But for the moment, he won't go without it because he can't sleep. And you can see he has the typical forward head position and the flat upper lip of an underdeveloped maxilla. You can see that he was orthodontically treated, unfortunately, with premolar extractions, which then left his upper jaw even smaller than it would have been before. You can see the tongue tie. You can see the square-shaped lower arch with all of those lower teeth tipping way in to try to squeeze underneath that underdeveloped maxilla. Let's hear what he has to say.
So, this is your 1 month visit.
Hello.
Why don't you let me know how your experience has been so far?
Sure.
And by the way, do you give me permission to use your video for
Absolutely.
teaching purposes?
Yeah,
Fabulous.
would love to help other people with the same problem.
Fabulous. Well, tell me a little about why you came and your case.
Sure. So I've had sleeping issues pretty much my whole life, and wasn't really aware. Went to an ENT, had a deviated septum fixed, did a sleep study, got no better. So was kind of lost for a bit, and then found Dr. Haller, did a scan of my airway. Turns out it's very, very small, tiny. So started doing the appliance and the treatment. I'm 1 month in. I would say, I'm wearing my appliance about 18 hours a day, so very committed to it. I've probably done 1.5 spins widthwise, a half a spin vertical, front and back. And I'm definitely breathing a little bit better out of my nose. I had to make a couple of adjustments with this. I used to use a full face mask where I had a lot of leaking, maybe due to the beard. But even my AHI numbers, so how many times I stopped breathing per minute or per hour, I'm not sure, was significantly higher. So I committed to the nasal pillow. I have no leaks. I'm sleeping a lot better, breathing a lot better, and I feel like I've got, my breathing in general out of my nose is a little bit better. I haven't been able to wear this yet because the nasal pillow that I bought doesn't necessarily fit with this, but now we're going to purchase another nasal pillow, and I'm going to start using this, as much as I can, definitely while I'm sleeping.
Little step by little baby steps, right?
Baby steps.
Baby
Yeah.
steps.
Yeah.
Fabulous. But so far, it seems like it's helping a little bit.
Yeah, definitely helping. And, one of the things I notice is that my bottom jaw, from wearing the appliance, as soon as I take it off, my bite doesn't necessarily align, and I feel like my bottom jaw wants to come forward. So it takes me, 15, 20 bites to adjust and bring my jaw back so that my teeth meet.
Yes.
But I think that's part of the process of, getting the front
Exactly.
and the bottom jaw to come forward.
Any pain?
No pain.
No pain.
No pain.
No pain. The appliances, not
Appliance,
pinching, not
no.
hurting.
No, the first time I wore it, one of my teeth felt a little sore the next day, but after that, totally gone. When I tighten it, when I do the spin, it feels a little just, but nothing gets sore, no pain.
Not like braces.
Not like braces.
Awesome. Thank you so much for sharing.
Absolutely.
Okay, these are the things you need to ask about. And it's not just snoring and fatigue, but it's also bruxing, neck and shoulder pain, chronic sinus issues and allergies, waking up gasping, headaches, migraines, TMJ pain, getting up to go to the bathroom multiple times in the middle of the night. Not everyone has obstructive sleep apnea. Sometimes they have what we call upper respiratory resistance syndrome. Either way, they're not getting good sleep, they're not breathing through their noses, and they're uncomfortable. Ask, when you see somebody bruxing, they're using those masseter muscles to open their airways because they're not breathing properly. You need to ask them how they're feeling. Do they wake up refreshed? And this is what you need to look for if they say yes to any of those things. You need to look for a tongue tie. You look for the long face with the flat upper lip in profile. A flat upper lip in profile means an underdeveloped maxilla, not necessarily just that the incisors are retruded. You want to look at that flat or convex profile. Remember, I asked you to look at that video over and over, that retruded or weak chin, or the opposite, a class 3 profile where the mandible has escaped out from under that underdeveloped maxilla. You want to look for forward head position. That's classically a tongue tie. And definitely check the arch shape. V-shaped, omega-shaped, or U-shaped arches with or without crowding and a high palate, big clues for airway issues. Look for those lower teeth tipping in to fit inside a too small maxilla. Look for a tongue that looks too large for the mouth. Maybe the mouth is too small for the tongue. Here are some examples of head position and profiles I want you to start looking for. The woman on the left has the classic convex profile with a little bit of a weak chin there, flat upper lip. The woman in the middle has a completely flat profile, and unfortunately her hair is covering it, but she has a classic forward head position. And then the woman on the right has both the classic forward head position and the convex profile. The man on the lower left has that flat face with the flat upper lip. The man in the middle has what I call the cosmetic mustache. Often men with flat upper lips grow a mustache to make their face a little more attractive. And even his cosmetic beard doesn't cover up his weak chin. And then the man on the right, you've seen him before. He is the classic class 3, which used to be considered only a surgical case. The V-shaped arches are the easiest to see. This is a case that I've been treating. He's a fireman, and he snores like crazy and can't always wear his CPAP machine, and wondered if there was a way to improve his sleep without the CPAP machine. I've been treating him for 17 months, and you can see the changes in the bone, in particular in the mandible. Look how there's room for his tongue now. Now, he's not finished by any means, but he certainly has more room for that tongue, which has come out of the back of his throat. And again, you notice I'm not working on the teeth. They're still as crooked as they were. That's for you guys. You send them to me like any other referral, and I enlarge the bone. Then when they come back to you, you can finish the teeth however you like. A little Invisalign, or if they have spaces instead of crooked teeth, you can do veneers or implants or whatever you like. This is strictly about widening the bone to allow more room for the teeth, and nothing to do with the teeth themselves. That's for general dentists like you. I put this together to just give you a general idea of arch shapes. Anything that's not the beautiful Roman arch, you should consider a candidate for an airway problem. The square or U-shaped arches, you know those black triangles when they smile. Any black triangle case, you know they have an underdeveloped upper and lower arch. The V-shaped arches, like my fireman in the middle, or the even worse omega-shaped arches, where the teeth have had to cave way in just to be able to fit. You notice on the bottom there's an example of a tongue tie as well. So what do you see here? This was an orthodontically treated case. It looks beautiful. Midlines are on, teeth are all straight. But you can see the tongue tie. You can see the high, narrow arch. You can see all the lower teeth tipping in. This person can't breathe, and they don't know why. Now you know why, and you'll know to refer for a frenectomy and for growing their arches wider. This woman wakes up with anxiety every morning. She, again, was orthodontically treated, but look at the shape of her arch, not just the high palate, but that square-shaped upper arch and the omega-shaped lower arch. The orthodontist even had to put a fixed retainer because those lower anteriors didn't want to stay put. She also has a tongue tie, and it looks like her tongue is too big for her mouth, when in fact her mouth is too small for her tongue. If you look at her airway on the Ceph, it is teeny tiny. We did her frenectomy, and we've started growing her maxilla, and her husband mentioned to her the other day that he noticed that she's not nearly as anxious anymore. This stuff is life-changing. I just can't say enough about how wonderful it feels to help people like this, who look like they have perfectly beautiful teeth and would never think that this is the cause of their anxiety. Hi everybody, this is a patient of mine who has been in his appliance for less than 6 months, and I would just like you to, can you first of all show us your appliance? Wonderful. And do I have permission to use this video for
Absolutely.
educational purposes?
Yeah, for sure.
Great. So can you tell us your story here?
When I came in, I constantly had sinus issues, allergies. I went months without being able to breathe through my nose. As I've been here, I've noticed I'm able to breathe better. Even like blowing my nose, things like that are much easier.
And that's just since wearing your appliance for a couple of
About
months?
3 months.
3 months.
Yeah, and I dream more when I sleep. I notice my sleep quality is better.
And so what else have we done besides give you your upper appliance?
We
Hint, hint.
have a face mask. Oh, we did a frenectomy also.
And
And
how was that experience?
that was not bad. It was pretty simple, straightforward.
And do you feel a difference from having just had your tongue tie
I
release?
can feel the placement of my tongue is already different. My neck and shoulders are looser. I think my head turns more like...
Greater range of motion?
Yeah.
So, and then now you were just getting ready to talk about the dreaded face mask.
Yeah, so
How's that going?
it's going good. I put it on to sleep, and the first night I even wore it was like the first night I remember having dreams in years.
Wow. I have put together a handout that includes some of the slides that I showed about what to look for. If you're interested in getting that, just send me an email and I'll be happy to send it out to you. I think this epigenetic remodeling is sort of like where implants were 30 years ago. People were doing it, but it wasn't considered mainstream yet. But I can assure you this is real. It works, and it is going to become more and more mainstream over time. You can impress your patients by knowing about it, being up on the latest, and also showing how much you care about their overall health. And just like any other referral, they come back to you. You're always their dentist, and they will be incredibly grateful every time you see them in hygiene. They will thank you for making a huge difference in how they feel in their lives.